It was really a program that was focused on solving a problem for core safety net providers, providers of last resort. And because of some other accidents of history and sort of reinterpretation of the rules, we now have this program that is kind of flipped on its head. And really, the hospitals, the nonprofit hospitals, are the biggest beneficiaries of this program.
All of the structural growth in the program seems driven by large hospitals and teaching hospitals. And so I've been putting out work that just measures that. And I think it's pretty uncontroversial from a methodological standpoint. You just have to count up who's growing and by how much. And you do that by looking at child sites, by contract pharmacy relationships, by the growth in those things over time. Um, where do they put those child sites? So we put a paper into Health Affairs Scholar last year showing that the sites tend to go into high income, well-insured areas, which is kind of the opposite of where you would want the treatment benefits to go. That's because that's where the well-insured patients are. And of course, those are the profit generators for the program.
340B covered entities tend to prescribe more expensive drugs than non-340B covered entities. They have a profound profit motivation to do that, right? If you can buy an expensive drug, have a huge 340B discount, and sell it at the expensive price, that is better for you than having a lower price drug that ultimately the patient pays for. They tend to prescribe more drugs than non-340B, similar non-340B entities, and they tend to mark up the price of their drugs even more.
I think that there's a need for patients to engage on this issue if they are the ones, in fact, generating the discounts or generating the profit opportunity for having purchased that discounted drug. And so I think any effort in this transparency game's gotta go all the way to the patient level and to make sure the patients are benefiting if they're being used as a source of profit for whatever entity they're affiliated with.